That's great. Thanks, Emma. So just to give you a rundown on the agenda, we're going to start with Emma Murta from the Wheel, who's going to give you an introduction to EU funding. And then at 2:15, Kay Duggan-Walls from the Health Research Board and Martha Cahill from Enterprise Ireland are going to give an overview of Horizon Europe health opportunities, which should be really, really useful. Then that's followed at 2:35 by Amanda Daley from the Health Research Board, who's going to run through EU for health opportunities. That's followed at 2:50 by a Q&A session moderated by the Wheel. And then we're going to take a comfort break at 3 p.m. So from 3 to 3:10, there'll be a comfort break. And then at 3:10, Jane Carrigan and Yvonne Halpin from the Irish Universities Association will run through the Mary Skłodowska Curie Actions Opportunities. That's followed at 3:25 p.m. by a really interesting case study from the All Ireland Institute of Hospice and Palliative Care. So Mary Rabbit is going to give you an example and a case study of their experience with EU funding projects. That's followed by a second Q&A session from 20 to 4 to 5 to 4. So that's 3:40 p.m. to 3:55 p.m. And then at 5 to 4, we'll wrap up. And Emma and I are going to give you a rundown of the supports available from Access Europe and also from Hrci as well. So I really hope you enjoy the day. I think it's going to be really, really useful for everybody. And with further ado, we'll kick off. Thanks, Emma.
Great. Thank you so much, Sarah. And thank you very much to everybody for joining us today. I'm just going to change my view here. So you should be able to still see the agenda there. Give me a shout if it doesn't work. But just to say, as I said, welcome everybody. My name is Emma Murta. I'm the European Programmes Manager with The Wheel, which many of you will know is Ireland's national association for the charity and the community sector. And we run the Access Europe programme, as Sarah described. So we provide all kinds of information and advice and training like today to various groups who are interested in EU funding. And our role is really to provide the kind of wraparound supports that are necessary to get started on or to build your capacity with EU funding. We are not experts on the intricacies of all the many, many EU programs that exist. I think that would be pretty much impossible, but we are here to kind of help organizations navigate the landscape. And luckily we do have fantastic national contact points in Ireland who are experts on their respective programs. And our role is to make sure that people find the right program and the right contact point for their project idea and are supported throughout that process. And luckily we have many of those contact points here today who will be speaking to us about their programs and about the opportunities that are available in terms of health research. So that's, I suppose, just a little bit of background. I'm not going to go into the intricacies of how EU funding works overall. It's really just, I just wanted to touch very briefly on some of the general characteristics so that hopefully it can make it a little bit easier for those of you who might be completely new, just to have a bit of understanding about how programs work and where the money comes from and things like that. So with that, I'll jump right into something called the Multi-Annual Financial Framework. So those of you who are involved in EU programs will know all about it, or the MFF as it's often called. It's just the EU's long-term budget. That's basically what it is. And it runs according to 7-year cycles. And it's where they determine what their goals are for that 7-year budget period and what they want to achieve through the funding that's allocated to the various programs. So we're in a bit of a transition period now, and that a new program just kicked off in 2021, a new framework, and it's good until 2027. So most programs at this point have been released, certainly any of the ones that we're going to be talking about today. There's obviously up-to-date information about those. Last year, we were still in the dark about many programs, and even now for some of the other programs, like the interregional programs, we're still waiting for calls and things like that to be announced. But it's a really good time in many ways to get started with EU funding because the information you do now, the research that you do now, the learning that you do now will kind of do you for the next 7 years. You'll have this, you'll have that full budget period to benefit from that capacity building, and you'll be well set then by the time they change things again in another few years. So this year, not only do we have a brand new and bigger than ever MFF, but we also have 3 additional budget lines that were made available to member states. So we have Next Generation EU, the Recovery and Resilience Facility, which is all around recovering from COVID, essentially, and the kind of economic and social fallout of that. And there's also been a €5 billion Brexit adjustment reserve that has been introduced for member states who are going to be hit hardest by Brexit. And actually 20% of that is going to go to Ireland, I suppose, in recognition that we'd probably be the hardest hit in Europe. And just to give you a little look at what that looks like, this is the overall multi-annual financial framework you can see there in blue, and then the additional things, the COVID-19 recovery package, recovery and resilience, Next Generation EU, like it's a 750 billion on top of that. So you're looking at a very kind of comprehensive budget, I suppose, for these 7 years. And just to give you a bit of an idea about what are the goals with the funding programs in terms of the EU, like why do they create these programs, and what's the relationship between the policy that the EU sets and the programs that come out of it. So funding programs are thematic, so they have things like education, environment, interregional. For this one, obviously, we're focusing on research, so these are research-based funding programs, and these are often referred to as financial instruments. They're there to put policy into action. So policy is what leads to programs being created. Programs are what leads to projects being funded, and often the results of those projects, particularly when it comes to research-based funding, go on then to inform future policy. So it's very much by engaging in European programs, you can directly or indirectly, I suppose, play a role in how future policy is shaped. So it's an important way to do that, but it's also very important that when you're applying for EU funding, that you're looking for ways that you can link your program, your project idea to European policy, because that's what it's all about. It's all about delivering on the EU's overall goals. And they publish these things called annual work programs, where they set priorities and conditions and timetables and things so that they can adjust, the policy priorities that were set at the beginning of the 7-year period can be adjusted throughout to meet various challenges and be reactive. So that's basically how it works. When you're talking about EU funding and you're in these billions and hundreds of billions of euro, it can seem that there's this just an endless amount of money out there. But I suppose obviously you have to keep the budgets in perspective. That's not all grant funding that's available to civil society groups. It might look like a lot of money, but a lot of it is absorbed by government, by big infrastructure projects, and through various other programs that maybe you're not eligible to apply for. So do keep budgets in perspective. However, there is more and more across EU funding this kind of push to have more charities, community groups, citizen representative bodies involved in projects. That's become more and more important. They're recognizing that an engaged research approach, a research approach that involves the end user as well as researchers, academics, industry leaders, that it's a proper cohesive approach where all of the various stakeholders are represented. That's being favored now, and they're specifically looking for it in a lot of funding applications where they want to see that civil society involvement in a consortium. So it's a great time for charities and health research bodies to be able to get involved in this and to work together with researchers to address societal challenges and to be that kind of, whether it's stakeholder representative participant or patient representative participant in a consortium. And then just to very briefly look at some of the kind of characteristics of EU funding. So these are just the kind of expectation setting, I suppose, that I always try to do whenever I speak about EU funding. So what it is it's an opportunity to learn and share, to connect with and influence policy. As I kind of described before, it's usually very much rooted in innovation. So it's not a keeping the lights on and the doors open kind of thing. It's about new, but particularly when it comes to research, obviously it's always about new innovations and the added value, and the kind of scientific element of it is very important. So they're very much rooted in innovation. It's an opportunity to fast track some strategic objectives that you might have, to get that kind of injection of funding that you need to get a piece of research over the line that you've needed for a while. It's an opportunity to collaborate with partners. A lot of the time, and particularly for research funding, it's almost always going to be across sectors, cross European. There's going to be partners involved. And it's a real opportunity to build your capacity and organizational profile. It is an undertaking, you know, administratively, and you know, the application. These are challenging, but like I said, through partnership, it is possible. And once you deal with it, and once you have the kind of processes in place, and once you've been through it a couple of times, it does become easy. And then it's a kind of a new source of funding that you can introduce into your organization. But you know, that was what it is. What it's not is, it's not quick. You know, usually it can take, you know, a year or more by the time you start thinking, right, I want to get involved in this, before then you research your various options, then you know, wait for the right call to come out, then you're building partnerships and building an application, and then it can take a long time before even contracts are signed then, and funding is, you know, so if you're thinking of, oh, we need funding for September for this thing, no, that's not going to happen. So it's not quick. This is an investment into your organization's kind of future, so it's important to see it like that. It's not easy, as I said, it is challenging, but it's worth it, and it does build your capacity for grants overall and funding overall. It's not without risk. These are projects. Projects are inherently risky. That's why they're called projects and not operational work. So as an organization, you can do a lot to help mitigate the risks, and that's what your national contact points and Access Europe are here to help you to do, to push kind of best practice procedures in place to kind of reduce the amount of risk that you'd be taking on. But of course, there's always going to be some element of risk when you're talking about taking on new things and innovation and collaborating with partners. So it is important to be aware of that and to make sure that your organization can withstand that. It's not core funding mostly. There are some exceptions to that, and maybe some of our national contact points will talk about the exceptions within their programs if they have ones today. But by and large, this is project funding. As I said, it's not going to keep the lights on or the doors open. It's project based, it's activities based, and it's not national funding mostly. Again, there are some exceptions to this across all of EU programs. You know, you'd be aware of things like the Peace Programme and things like Interregs and Leaders and things like that. Some of them don't require a partnership. It can just be a solo organization. But in general, like by and large, EU funding does. So it's just something to, if you're going to go into it, you know, go into it with an open mind partnership. So just be aware of that. But again, our national contact points who are here today to talk about their programs will give you more information about their specific programs and how it works for them. Just on the thing about partnership, I don't know if we have a lot of time. Christine, I'm going over time, so I might kind of skim over this a little bit. I was going to hand over, but just to make sure that we stay on track, because we have a busy schedule, I'm just going to go through this really quickly. Partnership can be a real challenge if you're new to EU funding. So the Access Europe and the Wheel, where that kind of manages Access Europe, we have a number of different ways that we can assist you with that. So we are running a training, which is on the 26th of April, around how to build an EU partnership. We can send information about that in the follow-up to this session. In case you're interested and you'd like to learn more about that, you're free to sign up to that. And we also have a partner database that is on our website. So it's accesseurope.ie, and this is a database where Irish organizations who are interested in connecting with EU partners around all kinds of different, any kind of topic, basically, including health and including research, can upload a profile outlining their organization, who they are, what they're interested in terms of EU funding, what kind of strengths that they bring, all kinds of different things. You can kind of create a custom profile for your organization, which we then upload to our searchable database, which is searchable by topic or interest. And then our role at Access Europe is to really push that out into Europe via various networks, via the national contact points around Europe, and to make that available with the goal of trying to encourage more and more people in Europe to invite Irish partners into projects. So again, we will send a follow-up link to that, including our kind of demo video that we did showing you how to use the database. We'll send all of that in the follow-up email, but given that partnership is sometimes an obstacle, it was something that we just wanted to flag. But with that, just to make sure that I'm staying relatively on time, I did just want to hand over to our first speaker. So let me just go through my agenda here. So first, for the next while, we have Horizon Europe Health Opportunities we're going to be looking at. And I'm handing over now to Kay Duggan-Walls from the Health Research Board and Martha Cahill from Enterprise Ireland, who are going to talk about Horizon Europe health opportunities. So over to you when you're ready.
Good afternoon, and thank you for inviting me to speak about Horizon Europe Health. I'm Kay Duggan-Walls, and I'm a national contact point for Horizon Europe Health, and I work in the Health Research Board. And Martha Cahill and I share the responsibility of the NCP for health. So the first thing I want to do is bring you right back to 2008, 2010, to this project, which was funded in the EU Public Health Programme, which is a forerunner of EU for Health, which Amanda's going to talk about later. And it was a project that was led by the European Patients Forum, and it was called Value Plus, and it was about promoting patients' involvement in EU-supported health-related projects. And the aim was to investigate the challenge of how patients and patient organisations can be meaningfully involved in European Commission co-funded projects on health issues. And what they meant by meaningful involvement was that patients took an active role in activities and decisions that have consequences for the patient community because of their specific knowledge and relevant experience as patients. So this is what the European Commission were promoting kind of towards the end of FP7. And there was two very valuable outputs from this. There was a handbook and a tool, and I've put the link there to the website. And there was also a chapter in the handbook on working with patient organizations. So it was guidance for researchers who wanted to involve patient groups into their projects. There's also here, I have another link to, this was a project which Martha, well, it's in the IMI, the Innovative Medicines Initiative, and Martha's going to talk about the next version of this. But this is a project which FPA and IMI put, it was lessons learned on including patients. And one of the researchers, or one of the representatives from the industry side in this report talks about, you know, they didn't really appreciate what patients and how patient groups could be included in projects. So it's a very interesting read as well. So how charities and patient groups can get involved. So this is some of the learning from that Value Plus. So patients could be involved in developing questionnaires or be part of a focus group. They could identify a project topic or aspects of the topic that interest them, or inform the project design as well, and they could be involved in the project steering group. Patient organizations could publicize results from a study to its members. The project could involve a strategy for supporting patient involvement. And if, and this is advice, I suppose, to the coordinators or the people involved in projects when you're including patient groups, is that you need to have resources for the recruitment, the induction and support, and expenses for grassroots patients, as well as training for specific project tasks, and that needs to be adequate. You know, you need to have a project plan that allows for adequate time and resources and for appropriate communication with patients or patient groups. And other examples of things that patients and patient groups could do is could review consent forms or patient information sheets in clinical trials and so on. So the idea was at the time was to include patients and patient organizations at the inception of the project, at the beginning, and, you know, not to have the, to include them throughout the project in the planning and decision making, as well as strategies for supporting their involvement. And so they have to be included at the very beginning, at the planning stage. But I just went back and looked at Horizon 2020 to see what kind of ideas were in that, in those projects. And it was things like involve patients and take their view into account whenever relevant. It should be tailored to the needs of citizens. Solutions could be cost effective and acceptable to end users. User acceptance, again, of ICT-based technologies. Where appropriate, patients and carers should be involved in the review, their views reflected in the research activities. You should engage with patient organisations, seek input from relevant stakeholders such as patients, involvement of those who work within healthcare systems, patients, family, relatives, and the general public is needed, and so on. And research is expected to be carried out in continuous partnership, in particular with end users. And this one was about, it concerned the women and the fathers in the community. It was about maternity care. Involve large groups of stakeholders, including patient organisations, again, opportunities for dissemination, communication and training activities. Participation of patient organisations should be encouraged in relevant activities. Public engagement, work lifestyle aspects, patient involvement, caregivers, leisure, social participation, end users, ethics issues, gender issues. So these are a whole load of different ways that patients and patient organisations could have been included in Horizon 2020 projects. And this is examples of charities that were funded in Horizon 2020. And we see there the Tobacco Free Research Institute was funded in 2014 and 2015 as a partner in these two projects. Then the European Health Management Association was also funded in 2014 and 2016 as partners. Cancer Trials Ireland was funded in 2017, and Hrci was the coordinator for this project. In 2019, the National Suicide Research Foundation was funded as a partner, and UCC was the coordinator of that project as well. So now I'm going to talk about Horizon 2020, and in Horizon 2020, the first year of calls for 2021 have closed, and we have the results of those. And now the calls for 2022, the two-stage calls close in February, and then the single-stage calls will now close in on the 21st of April. So I think sort of time has run out now for the 2021 and 22 calls. But to give you an idea of the kind of wording that's in the calls, and this was a two-stage call that has now closed. But I think of the calls that are in the health work programme, I think Destination 1 might be the most appropriate area where charities and patient groups or patients could get involved. And then here in this one here that's closed, it was about boosting mental health in Europe in times of change. And you can see here, it talks about proposals should involve end users, civil society organisations, strategic partners in the design and during the course of the project. Possible end users and strategic partners include local and regional authorities, community services, employers, schools, universities, cultural institutions, and so on. Proposals should adopt a patient-centred approach that empowers patients, promotes a culture of dialogue and openness between health professionals, patients, their families, and unleashes the potential of social innovation. So that's the kind of wording that's in the health programme. And just to remind you that the health work programme is about multidisciplinary proposals. So you are encouraged to include all sorts of different types of people in your proposals. So there is an opportunity for health research charities. So this is the topics that are still open and the closing on the 21st of April. And this one is about a personalised blueprint of chronic information in health to disease transition. And in purple here, I put the wording for proposals should adopt a patient-centred approach to inform and empower patients, promote a culture of dialogue, openness between health professionals and their families, and so on. And then the next one is about methods of assessing health-related costs of environmental stressors. And here it doesn't really have much about patients or patient organisations. But in many of the topics under the expected outcomes, they talk about citizens and what's expected for citizens and what the outcomes might be in the long run. Then the next one is about pandemic preparedness. And again, there's not much about the patient organisation or patients. And the next one then is about non-communicable diseases, risk reduction in adolescents and youth. And this one is to consider interventions at the individual, family, community, work or school, population level. Strategy to include other relevant stakeholders such as community groups. And the engagement should inform the conception and development of the project and should continue throughout the duration of the project and afterwards during the knowledge transition phase. Their contributions should be nurtured through meaningful engagement throughout all phases of the project and not only as participants in the research undertaken. And we have another call, Better Financing Models for Health Systems. optimizing effectiveness of patients of existing prescription drugs, and then new methods for the effective use of real world data. So this could involve citizen and patients representatives where relevant. And the next one, setting up a European electronic health record exchange format, again include patient associations. And then we have some more topics here. And the last one, setting up a European Smart Health Innovation Hub. So that proposals should encourage a people-centered approach that empowers citizens and patients, again, promotes a culture of dialogue between citizens, patients, health practitioners, and so on. And I just, sorry, they're the calls that are in the health work program at the moment, closing on the 21st of April. But we're at present working with the European Commission to develop the 23-24 work program. So if you want to contact me, and I can let you know what's in that, so that you can prepare for these calls when they will open, probably later in the year or early next year. Yeah, the other thing, that I wanted to say about the calls that have closed, there was calls on mental health, obesity, one on palliative care as well, tackling diseases, and the All Ireland Institute of Hospice and Palliative Care have been involved with researchers in a number of projects, and also the European Institute of Women's Health has been successful in 2021 proposal. So I've just put here a list of resources that are available, and I've written 3 blogs which are on the HRB website. One is for tips for applying to Horizon Europe in Health, one proposal writing tips, and also one on consortium building. And there's also an awful lot of information from the European Commission on how to write a successful proposal, and I will send on the links to those. They're on the European Commission YouTube website. Then the HRB has a monthly e-zine, and in there we update when the Horizon Europe calls will be coming out, as well as other information on Horizon Europe in Health. And also on the HRB website, and the HRB has done an awful lot of work on PPI, public and patient involvement. So there's a link there to stories for the lots of interesting stories how to include patients and patient organizations. And I suppose a final word on this topic is that in Horizon European Health and previously in Horizon 2020, humanities and social sciences were encouraged to be included in proposals. And the thing was that quite often, you know, the people, I suppose, the coordinators of these health projects were only thinking of maybe of the scientific end or the health end, but they weren't thinking of how to include the humanities and social sciences. So, I mean, my advice to them was always to look at the projects, and the same to the health charities as well. Look at the topic and look to see where you can make a meaningful contribution, and then go out to people who are coordinating or partners in projects and say, this is where we can contribute. So you have to look at what the special contribution of patients or patients organizations could be in these projects, because they are very multidisciplinary, and you have to include all sorts of different actors in the proposal. So that would be my advice, to look at the topics very carefully, look at the wording, see where you can make a contribution, because maybe the people, the coordinators may not think of you, may not see where you can make a contribution, but you have to push that agenda yourselves. And the final slide is just the health team. There's my colleague Hrci Clark, who's the national delegate, and she's in the Health Research Board. There's myself, and there's Martha, who'll be talking shortly, and we work on Horizon Europe Health. And thank you very much for your attention. I'll answer questions later on.
Thank you, Kay. Just I think Martha's going to come in now, and just a warning that we have 5 minutes left for this slot. So over to you, Martha.
Pressure, no pressure. Okay, so I'm, in addition to being the national contact point for health, I'm also the state representative for IHI, which is the Innovative Health Initiative. Okay, I'm going to try and explain this as quickly as I can. You may remember the Innovative Health Initiative, which was a joint project with FPA, which is the European Pharmaceutical Industry, and the European Commission. This program follows on from that, but brings in a lot wider industrial partners such as Europa Bio, Vaccine Europe, MedTech Europe, etc. And they have their own website now as well, so you might take note of that. But basically, you have this wider network of industry partners involved in health research. Okay, so just to explain, about 1.2 billion comes from our health program within the Horizon Europe program, and 1 billion comes from these industry partners. They also look to contributing partners. Sometimes these contributing partners, I have a couple of examples down here at the bottom, the Wellcome Trust, Bill and Melinda Gates Foundations, Parkinson's UK, Autism Speaks. So they can be charity organizations that have large amount of funding and they might be interested in doing some research. To date, they have commitment for over 200 million from contributing partners. So this whole consortium and partnership will be 2.4 billion euro worth of funding. The focus of this partnership is going to be slightly changed because you're bringing all these different industry and technology companies together. So you're looking at pharmaceuticals, diagnostics, medical devices, imaging, biotech, and digital industries. Okay, so they kind of work on this 5D initiative, which of diagnostics, drugs, devices, delivery, and data. Big focus on data and the integration of new projects into the healthcare system. So how do you find out more about what this partnership's about? Your main document is the strategic research agenda. This tells you what this program is going to focus on for the next 7 years. So this will give you a full overview on what they're going to work on. So what's going to come up in the first call? This is this particular document here. Both of these you can click on my slides when you get them. In this, they've highlighted the first 7 different topics that they're going to look at, and I'm going to go and mention those now. And basically, this document just gives you a little bit of a paragraph, but we're at the stage now where we're still just trying to flesh out more detail in relation to these particular topics. So just overall, right, this strategic research agenda, it basically tells you their whole objective is to work on 30 large-scale projects in the area of research and innovation over the next 7 years. And they are also going to give 5 examples of where they integrate healthcare solutions better into the healthcare system. So that's their ambition and their goal. And then basically cross-sectoral activity as well that lines up with the European pharmaceutical strategy. So one of the objectives within the strategic research agenda, they lay it out, is to involve patient care and citizens, okay? And they actually say that in there. And when you start to read the document, you will start to see all the references to patient care. It could be patient self-management, patient access to care, patient involvement, the voice of the patient, and basically tools to facilitate patient engagement. And IMI previously funded several projects in this area, and I'm going to link you to some of those as well. So these are the calls that are in the first round. So you have single stage calls. And as you can see, then these are just the headings. I'm not going to go into the details of the workings of it, but the innovation patient-facing pathways, again, from the offset, patient is built into the topic, okay? You have 2 particular projects here that are going to focus on cancer, one on the next generation imaging for cancer, and the second one on precision oncology, which is innovative patient-centric care. Again, you know, it's built into the whole topic, patient care and patient engagement. So the last one then is access and integration of healthcare data to improve healthcare in disease with high unmet public health need. Now, the second ones, there are 2 stages. Okay, so basically you're gonna be lined up with big pharmaceutical industry and some of the bigger players within the partnerships as well. So these are generally expected to be larger scale projects and more ambitious projects. The first one is new tools for prediction, prevention, and monitoring of cardiovascular disease, and then strengthening EU clinical development. So again, this is about early feasibility studies and making sure that they're taken up by patients and in care. We're at the stage now where we're trashing out the content of all of these topics. We don't have a whole lot more detail other than that thematic document that they've published on their website. We're starting to work on the negotiation process for that. They're anticipating to open these calls in June. And in terms of getting involved and being engaged, they're actually going to hold a brokerage event when these calls open. So I will keep you informed of these, and I'll tell you how to stay informed yourself on these activities. So Kay mentioned several funded projects under IMI. These are a couple of examples of projects that were previously funded. This one here, iPatty, is a very interesting one because similar to the handbook that Kay has, there's some really interesting online tools and resources and in terms of patient engagement on the website as well. There's another one here. So I'll leave you to take a look at these in your own time, but these are the ones that I found where we have Irish involvement. And on the IMI website as well, you also have, they previously held a webinar, and they're very good at, to be honest with you, IMI and IHI are very good at communication. So their newsletters are good, their webinars, their briefing sessions are very good. So they previously had a webinar on patient involvement in projects, and also they have the presentation still there. The webinar, I couldn't see the link directly to the webinar, but the presentations are still there. You can also search through previous projects on the website, which is very, very useful because you can see the types of stuff that is actually previously funded. And also you can search by different teams and disease areas as well. So that might be of interest to certain charities and organizations. So if you take a look through their website, as you say, they'll start, this is the new website, they'll start to categorize projects into different areas, into different disease areas and things like that. So that makes it very interesting and a little easier to navigate. And they're very good, as I said, in terms of their newsletters. So all announcements are pretty much open. So I suggest signing up for that. And also, once you sign up, you will get updates on the new events, the brokerage events and things like that. So that is the easiest way to stay involved. One thing that's going to happen, possibly by the end of the year, is they're going to open up kind of like an expression of interest to what they might fund in future calls. We're not quite sure how that process is working. They're working on it in the background, but at the moment the teams that are proposed in that document are what is going to happen in the first round, but this will influence maybe future calls.
Okay, we're just coming up. Oh, you're finishing
I'm
up
nearly
now.
finished. I'm nearly finished.
No worries,
I swear. So I've actually done a full newsletter on this as well. So if you click this link on the website, you will get an updated newsletter that kind of basically lays out the structure of this particular program, how it works, and so on and so forth. And you'll get access to the documents and interesting resources. So just then, in terms of how to keep up from my side, we do have a newsletter for health. If you go onto our website, horizoneurope.ie, you can go /health if you want to go directly into the health newspaper, or you can just click health on when you register on the front page, and you can sign up to my newsletters. Myself and Kay, we push out information as soon as it arrives with all the calls that are open as they arise, and that'll include the health program for 23-24. And basically, please feel free to reach out at any stage, and I'm happy to talk to you. And I hope I was fast enough.
Not at all. Thank you, Martha. No worries. Look, we might have to eat into a little bit of our Q&A time because I want to make sure we have enough time for our next speaker. But that was absolutely excellent, and I think from both Kay and yourself there, we could see just the real emphasis on patient involvement. It's no longer a nice addition to a project. It's a necessary part of a project. So, and that's where I think Health Research Charities can come in and really fill that role. So look, that's absolutely excellent. And just a reminder, if you have any questions, we're very aware that this is a lot of information. So don't feel overwhelmed. You'll get the recording, you'll get follow-up materials. We're just trying to give a broad overview so that if there is something that kind of piques your interest, you know where to go to get more information. But do ask any questions that you might have in the chat there, and my colleagues are kind of collecting them for us so we can come back to them in our Q&A session. But now I am going to hand over to Amanda Daley of the Health Research Board, who's going to talk about the EU for Health and the opportunities under that. So over to you, Amanda.
That's great. Just share my screen now, 1 second. So I hope you can all see this. Yeah, great. So so as Emma said, my name is Amanda Daley. I'm the National Focal Point for EU for Health. And many of you may not have heard of this programme yet. It is the 4th EU public health programme, but compared to its predecessors, it is a much greater scale than the previous programs. And with that comes a significantly higher budget of 5.3 billion euro across the 7 years. So, and it represents, I suppose, the largest ever investment in health from the European Union. And just, I suppose, again, it represents that it's saying that, you know, public health is a priority in Europe, and it's also the EU's response to COVID-19. And the aim of the programme is to support the fight against cross-border health threats and boosting the preparedness and capability to respond effectively to future health crises. So with this significant budget, there comes an ambitious vision. And this is represented not only by the different strands of the programme, but also by the breadth of actions that it funds. So it'll go beyond this crisis response and to support and complement national health policies for strengthening and modernising health systems, reducing inequalities and overcoming shared challenges. And just to give you a brief overview of the general objectives, so they fall under 4 different objectives. The first is to improve and foster health in the Union, to protect people from serious cross-border health threats, to improve access to medicinal products, medical devices, crisis-relevant products, and the 4th is to strengthen health systems. And I suppose I think at this point it's appropriate to tell you the difference between the EU for Health programme and Horizon Europe. So just that as Horizon Europe and other funding programmes discussed today fund research, EU for Health does not specifically fund research. It's dedicated to health, but doesn't fund research, but it does support the uptake of research findings and best practices and pilot programs. So there is a strong link between research and the EU for Health programme. The main objective of the programme is to support and implement European policies, as Emma alluded to earlier on. That's the whole objective of these EU for Health programs, is to support a number of policies. And I suppose the objective of the EU for Health policy is to pave the way to a European health union, and that's by investing in urgent health priorities. Some of the policies that it will support are Europe's Beating Cancer Plan. So of the 4 billion is attributed to that plan, 1.25 billion of that will run through actions supported under EU for Health. There's also the pharmaceutical strategy, cross-border health threats, and the other one is the Hrci. I'm not sure if you've heard of it, but there's a new authority in Europe. It's the European Health Emergency Preparedness and Response Authority, which has been established now in response to COVID-19. So there are a lot of opportunities, though, for charities, civil society organisations, and I suppose it's very new. The programme, it was adopted in 2021, and it's implemented through an annual work programme. So the first annual work programme was 2021. The second work programme is 2022, and that was just adopted in February. And this programme lists the full actions of a full list, I suppose, of actions to be supported in 2022 and the indicative timelines for the different call launches. For those of you that actually want to input into the next annual programme, there's always a consultation process which give stakeholders, including charities and patient organisations, to input into their priorities and strategic orientations into the annual work programme. And I would encourage you to do this, and I will send a link when that consultation is open, and it's likely to take place during the summer. So similar to the 2021 programme, the 2022 work programme has 4 different strands. So it's disease prevention, crisis preparedness, health systems and healthcare workforce, and digital. I suppose here the most appropriate is to just talk about, say, disease prevention, which is, it falls under the improve and foster health objective, to reduce the burden of communicable and non-communicable diseases, to support health promotion and disease prevention, and reduce health inequalities. So just to note to say also that the health inequalities is really a strong component of this programme. The whole concept of these European programmes is not to improve the quality of health within a given member state, but also to kind of bring all the other member states up to a certain bar, a standard of healthcare provision across Europe. So different to the Horizon Europe, the EU for Health has quite a complex funding mechanism in place. So it falls under 3 different types. There's grants, there's public procurement, and there's prizes. And under the grants, there's those divvied out between, so there's joint actions, and they fall under the responsibility of the Department of Health. So they would themselves get involved in those or nominate certain state agencies. Then the action grants are the ones that are most relevant here today, and they're open to any legal entity. And I'll talk more about them in a little while. And then there's other direct grants for different international organizations, like such as the WHO and OECD. There's a list of there's a number of public procurements that are open to any legal entity as well. And I'll just list a couple of examples later, so just to get a flavor of what's on offer. And then there's the prizes, and that's to promote achievements of policy objectives. And unfortunately, in 2022, there aren't any prizes, but I'll just give you an example of the prizes that were available last year in cancer prevention and mental health. And these were to reward community-based initiatives or NGOs in different projects that they undertook. So these are likely to come up in future work programs. So just to keep an eye out for those. In terms of the grants, I'll just come back to them. And there is actually a co-funding model here, unlike some other programs which are funded to 100%. EU for Health is not. It's the Commission will provide funding to a level of 60%, which is a normal co-funding rate, or up to 80%, and that's in the case called exceptional utility. And there are specific criteria that need to be met for this, and it's relevant to the number of countries that are involved in the application and I suppose their economic standing. So, but in saying that, although there's 40% needs to be supplied by the beneficiary of this grant, it's not expected to be in terms of cash contribution. It is expected to be mostly, 80 to 90% in kind staffing contribution. So anyone working on the grant employed by those beneficiaries of the grant. So that is it can be a challenge for some, especially say in the academic sector. But if the action aligns with what the organization is planning to do anyway, there is definitely still an incentive to go ahead and go for it. Now there is actually for charities and civil society organizations, there is the option of an operating grant. So that is to ensure participation of health NGOs in activities to implement one of the objectives of EU for Health. Now, the only caveat with this is that to be eligible, an organization must be active in at least half of the member states. So I'm not sure, that may not apply here, but there are some organizations that may be relevant. And so that was reinstated this year in 2022 with a budget of 9 million. And I suppose that will just fund a number of different European organizations for the year. Just wanted to let you know of that. Then, so I mentioned the action grants. And so the action grants are those that similar to kind of open calls for proposals for a specific action. So I suppose unlike other programs, the actions that are outlined in EU for Health are quite specific. They have very clear objectives of what is expected, what activities to be supported, and what are the expected outcomes. And I'll just give you an example of some of these that are open at the moment. So there's a call for proposals on promoting mental health, and then call for proposals on prevention of NCDs in cardiovascular diseases, diabetes, and other NCDs. And one of these, that falls under 3 different subtopics, and one of the subtopics on other NCDs is open now. And there's a call expected to launch later in the year on cancer and other NCDs, prevention action on health determinants. So these action grants are almost targeted at civil society organizations. Other actions are much more open in their application or applicant pool, and it is expected that civil society can partner with other organizations in getting involved in these calls. So I'll just run briefly through those ones that are open at the moment. In mental health, it's all about improving and fostering health in the union. And the specific aim is to increase awareness, knowledge generation and sharing and building capacity in the area of mental health. And the idea behind this call is there's two different subtopics, and it's to the transfer of best practices. So there are two different practices that were developed by the Finns, and these are called ICE Hearts and Let's Talk About Children. And it is the plan of this action is for different member states to take this to join up with the Finns and run these different best practices within their member state. So it's because they've proven to be extremely successful in their adoption. So that's an opportunity for those that want to take up a best practice. And I suppose the expected outcomes of these are increasing the number of interventions being scaled up by different member states. And then the long-term impact is ultimately identifying solutions to tackle mental health issues, both at a personal and societal level. And again, here, if you see the targeted applicants, it's quite short. It is just academia, educational, civil society organizations, foundations, NGOs, and there's 4 million for each of the different subtopics. And I've been contacted by the Finnish. There's a Finnish charity that are planning to lead on one of these. And if any Irish organizations are interested in getting involved, please do get in touch. And the second call that I'll just briefly mention here today is to reduce the burden of non-communicable diseases. So it's the prevention of non-communicable diseases, and it's excluding everything from cancer, cardiovascular diseases and diabetes. So I suppose the focus is more on, say, the likes of kidney diseases, liver diseases, autoimmune diseases, musculoskeletal conditions. And the aim of the action is, again, to reduce the burden of these by increasing awareness, sharing knowledge and building capacity to improve public health, especially at a local level. So that's where the community side of things really comes in. And again, the activity support will be the transfer of promising practices and approaches which contribute to tackling the burden of NCDs. Now, they haven't listed any specific best practices here. So I suppose the idea is that civil society organizations would run projects and activities and complement the activities of member states and plan implement of these best practices to support the definition of public health guidelines and prepare the rollout of new policy approaches to piloting new innovative practices. They also support training and twinning, health communication or health literacy. And activities should also include an equity dimension and aim at reducing health inequality. So that is, again, that similar concept of really addressing health inequalities. And there's 11 million euro. Oh, sorry, it's €4 million for that specific topic, but and that's open now. So if anyone has, or anyone knows of anyone interested in getting involved in something like that, please do get in touch. This is my final slide. It's just about the opportunities for public procurement, and you might think, does that really apply to me? But actually, they will be open tenders that are published on the TED website. And they're just actions. They're almost like little studies and evaluations. So one is on tobacco control policy, implementation and modernization of tobacco control legislation. And then a second is a study on effectiveness of health information on alcoholic beverages, study on the evaluation of EU action plan on childhood obesity. So if they're in the area of your charity and you're doing similar work, it may be an opportunity for you to get involved in that. So I suppose this is just a very brief overview of EU for Health. All of the relevant information is on the HRB website under the EU for Health information tab, with specifically with 2022 work program is the actions that are currently open. If anyone has any questions, I'm here for the next 10 to 15 minutes. I'll have to leave after that, but I hope that wasn't too long or complicated, but that just gives you a snapshot of where we're at. Okay.
That's fantastic, Amanda. Thank you so much. I think that was really interesting oversight. And we haven't had any questions come in, but I suppose, and we are going to finish up for the break now in a moment, because we don't want to eat into people's breaks. But just a note, I suppose all three who've spoken so far, like one of the things that I suppose I would say to a lot of organizations who are contacting me interested in research funding is that there's probably just a handful of charities in the country that have the capacity to actually go ahead and lead an application themselves and write the application. More often than not, it's about their actual role is more about networking and reaching out to researchers and academics who are working in their area and building connections, so that when calls do come up, there's partnership there, there's an opportunity there to kind of join in on a call and be that kind of civil society representative in a consortium, as opposed to driving the whole process. So I just wondered, what do you think of that? Is that what your understanding would be as well of the role of charities, or have you seen charities lead applications, or is it more about, is their first goal here, if they're going to get involved, more about scoping out who are the researchers working in that area? So I can see a little hand up, Kay.
Yeah, I know in FP7 there was a charity who did lead on a project, and I suppose maybe in FP7 the proposals were maybe more disease orientated, or whereas now I think because they're so broad and you have to include so many different people in them, it may be more difficult to lead on it, but certainly to start off, and it's the advice I offer to everybody, to start off as a partner, because you can learn then about how to put a proposal together, and so on, and you don't have the burden of being the coordinator in your first attempt as well. Yeah. And the other thing it would be to look at other proposals that are funded and talk to people that have been funded in the past, and see what they have done, and what charities have been included, and what the role of the charity is. Because if you look on the websites of projects that have been funded, you can see the different work packages and who's doing what, and you can see then what their role is.
Yeah, I 100% agree, Kay. I think whatever the scale of the grant, being a partner first is a lot easier. So yeah, sorry, I can see you have your hand up as well, Amanda. Oh, you're on mute there.
Oh, sorry. Just to answer your question on whether it's the role of the charity to contact the researchers, I think that's one of their roles, but also another one of the roles is to actually partake in an application. And I know there are, even in 2021 program, there was a call to actually support a youth cancer network. And I know, speaking to a couple of Irish charities, they ended up getting involved and partnering with the European Cancer Organization on that application, so that opportunity can then come to Ireland. So Ireland can get involved in these different activities. Now, whether they're contributing at a high level, once you're at the table, you can get involved and you have a say. And so there is that I think that's important as well. They may not, and it's a starting point. Once you get involved and you see the opportunities and you hear of them, because there's always the next level of funding. So if you're at the table, you mightn't get involved too heavily at the beginning, but then there is future opportunities that will also always involve the ones that have already gotten the funding. So yeah.
100%. I don't think projects always lead to new opportunities, I think, and new connections. And even, I think a slow and steady immersion into EU funding is probably the more the way that will kind of protect your sanity, I think, as well, in terms of getting involved. So sorry, Martha, I see your hand up as well.
Yeah, I kind of agree with Kay that the nature of the projects at the moment are very multidisciplinary. Like, I mean, if you look at some of the ones in the health call, they can be quite technology led, a lot of data exchange, AI for patient, care and kind of disease prevention and things like that. So sometimes the role, I suppose, of the patient voice is within the project. So, but you could take work package leads and things like that, and also feed in. I think one thing that we didn't get into today was anywhere there's clinical trials and clinical studies, you do need to also submit your details in relation to that in a separate document. So feeding into that is very, very important as well. One thing I didn't mention actually on my side is that at the end of IMI, the IMI group did tried to do a mapping exercise of all the patient organizations and charities and stuff like that across Europe from all the different member states. They tried to map them all. I inputted into that, and I have a copy of, I suppose, some of your equivalents in Europe now, and I think they're going to work on that a little bit more and refine it, because not everybody, worked on it to the same level or extent, but it is a good place to start. So you could just say, for example, in the case of rare diseases where you don't have a critical mass of patients, you could also work with your equivalent counterparts within Europe as well. And it's just a combined vice of different patient organizations across Europe can also make a difference,
Yeah,
so
that's an excellent point. I think it comes down often to that networking and partnership
absolutely
piece.
yeah
So look, that is absolutely excellent, and we're eating into break a little bit, so we will go, but just, I suppose, that for anybody, just to note that if any of this is piquing your interest and you're thinking, I'd like to look further into this, reach out to the people here. Everybody provided their details, and we'll provide them in the follow-up as well. Reach out to Access Europe and we can help you to navigate it. It is overwhelming, but there is kind of support there as well, and that's what we're here for. So we'll take a 10-minute break now, and we'll be back at 14 minutes past. So we're running 4 minutes over. That's not the worst. So please do get up and move around a little bit, take a break from looking at the screen, and we'll see you back here at 14 minutes past. Okay? Great. Thanks, everyone.
Thanks, Emma.
Okay, I think we can come back now. It's about 14 minutes past. We're just running a couple of minutes over. Before I hand on to our next presenters, there was just a couple of questions that came up and I wanted to address them just during the break there. So there was one from, I think for Martha and Kay, if we still have Martha and Kay, which I think we do. If you're back, sure. Oh, I can see you're there. Okay, so I might address the first one if that's okay. So there was a question if charities are eligible to the same support services, for example, travel bursaries for networking events that researchers and innovators are under Enterprise Ireland and HRB schemes for EU grants. So I don't know if that's the case. They seem to think that they wouldn't have been eligible.
Well, we in the HRB we don't have any funding to support coordinators for Horizon Europe, but Enterprise Ireland does. So I'll let Martha answer that.
Okay.
Okay, I think this is a little tricky for me to answer, to give you a straight answer, because I'm not sure myself, right?
No worries, yeah.
I think they were trying to look at changing the policy in this regard, because typically a charity organization is generally an SME of some sort, and our SMEs are generally clients of Enterprise Ireland. If there's somebody interested in looking at getting involved in a consortium or an application, please contact me and I'll see if I can work that out. Okay, so that's the only thing I can do right now, because I was trying to find it out myself with my colleagues during the week, but I think there's some policy there just because of the nature and the structure of them. Now, I know Garrett Murray was looking at this last year, and I thought that there was an amendment to the policy, but please come back to me and I can try and address that again. Okay,
that's perfect, Martha. And actually the next one was addressed to you as well. It was just about that map of patient organizations you mentioned. Is that freely available anywhere? Or maybe
I just responded there, and it's not, but you can ping me an email and I'll send it on to anyone that's looking for it. Now, it is very, very drafty, as in, as I said, different countries just responded in different ways. I wrote a massive Excel spreadsheet and they put it all into one document. I literally found everyone I could find, and there's probably still some I missed, but I think they're going to try and revise that as IHI grows and develops as well. I am going to drop you a little text there as well to a nice link for an early draft of 23-24, given that it's publicly available as well. So that's a little present for anyone who wants to see what's coming up in the next few years. Okay, reviews and come back to us.
Bedtime reading. So that's great. Thank you so much, Martha and Kay. That's perfect. So I'm going to move on now to our next presenters. So we have Dr. Jane Harrigan and Dr. Yvonne Halpin both from the Irish Universities Association, who are going to be talking to us about the Msca Hrci actions and opportunities under there. So over to you guys when you're ready.
Thanks, Emma. So I will talk to you just for a quick minute to introduce who we are, but just to say on behalf of both of us, thank you to the Wheel and to HRCI for the opportunity to present on the European Union's Msca Hrci actions, or MSCA as we refer to them from here on in, because that's quite a mouthful to keep saying over and over. And Jane, you can pop to the next slide, please. So just to quickly set the scene, because I don't want to take too much of Jane's time here, but myself and Jane are from the Irish Msca Hrci office. And just to say that we are the representatives of the MSCA programme in Ireland. So the office hosts the national delegate and the national contact point roles for the MSCA. So if you're interested in this programme after Jane presents on this, please do come and get in touch with us. So the office is supported by the Irish Research Council, but very much operated under a joint partnership with the Irish Universities Association. But we work with organisations from across the academic and non-academic sectors, such as yourselves as well. And really, our whole mission is to promote the programmes that are represented by the office. So that actually includes the MSCA plus the European Research Council programmes from a social sciences and humanities perspective. And then also one of the other programmes under Horizon Europe, which is known as Cluster 2, and that's Culture, Creativity and Inclusive Society. So we do things like webinars like this, information sessions. We provide some hand-on support to applicants who are applying and contribute to policy initiatives as well. And Jane, you can move to the next slide, please. And so before Jane will take over from me, just to say, so this graph, some of you may or may not have seen this before, but this is really at a high level the structure of Horizon Europe, which is the European Union's current framework programme for research and innovation, and to say that the MSCA are based in Pillar 1, and that's really important because the MSCA are what's known as a bottom-up programme. So it's funding grants for primarily doctoral and postdoctoral projects, and really all around training and career development for researchers through excellent research and innovation projects, but very much open across sectors. So I will hand over to Jane now, who will take it from here. Jane might be muted, are you? I can't hear you.
Jane, I think I can see that you're not on mute, but we can't hear you, I'm afraid. Yeah, I think so. I heard a little bit.
Great.
Try.
Can I try?
Yeah, okay.
Brilliant.
Yeah, that's it.
Thank
Thanks,
you.
Jane.
I've taken off the microphone, so obviously it didn't work. So what are the MSCA? Well, the MSCA are named, as you know, after the inspirational and Nobel-winning scientists, but they're a key source of European funding for research in Ireland across all disciplines. And they're the European Union's reference programme for doctoral education and postdoctoral training. So they support researchers from all over the world with a focus on their training, skills and career development. Lots of organisations can apply, and that includes non-academic organisations such as charities. I think my mouse, everything seems to have stopped here. I'm not sure if you're getting. Oh, yeah, great. Sorry, I'm a little bit behind schedule. But lots of universities can apply, including non-academic organisations who can host and train researchers at no cost. And under Hrci 2020, Ireland has been very successful in securing MSCA funding with over 197 million euro awarded. And that's over 500 projects with more than 1,400 researchers. So what are the key features of MSCA? Well, the motto is developing talents and advancing research. And a key factor in any MSCA scheme is to support the mobility, training and career development of researchers. And the MSCA does this through a number of means, including postdoctoral fellowships, doctorates and collaborative projects. Another factor is that it supports excellent research in all domains and disciplines and with a bottom-up approach. And by bottom-up, I mean that researchers themselves decide the focus of the research problem they want to address, so it's not predefined. MSCA is also about what can be called the 3 I's: international, intersectoral and interdisciplinary mobility and cooperation. And it's about stimulating such cooperation. Another feature that the MSCA prides itself on is the promotion of attractive working and employment conditions. And it places great importance on principles contained in documents like the European Charter for Researchers and the Code of Conduct for the recruitment of researchers. And as such, its impact is not just on career development, but also on organisations. And participation of the non-academic sector is strongly encouraged. So who can apply? Well, the academic sector can apply, so universities and research institutes, and they do, but it's also open to the non-academic sector. So non-academic eligible legal entities can apply also, and that can include charities, civic society organisations, NGOs, hospitals. A good starting point is to think, what can MSCA offer you as an organisation, and what are the benefits of it? So it's an effective way of receiving funding for a research project that aligns with your organisation's research needs. And the bottom-up approach is really attractive in this regard. It's also a way of doing cutting-edge research in a cost-effective way that will strengthen your research and innovation capacity. It's a way also of accessing talented researchers, and it may give you access also to state-of-the-art technologies and infrastructures through the collaborative network that you otherwise wouldn't have had. Plus, it will help grow your organisation's visibility and reach. And what are the benefits to researchers? So I've mentioned that mobility, training and career development are key features of the MSCA. So you can see the benefits that it will offer researchers in terms of gaining new knowledge and transferable skills, and gaining new experiences, including intersectoral, international, and interdisciplinary ones. It will also give researchers access to networks and organisations, and access to people with sometimes different ways of doing things and different ways of thinking. So all of this will help career and employment prospects. So huge benefits to researchers involved. What are the types of funding under MSCA? Well, there's 5 different types of funding, and each with specific targets. But I'm going to mention 4 that fund research and innovation. So postdoctoral fellowships, doctoral networks, staff exchange, and co-funds. And a useful way to, I suppose, think about MSCA is to think about you and what your organisation needs. So if you're looking for a highly qualified postdoctoral researcher to work with you, you might think of the postdoctoral fellowships. And these are, this is a call in which a pre-identified researcher applies with a host organisation, and together you work on an application. There will be eligibility attached to the researcher, including mobility ones. So, for example, for the European postdoctoral fellowship, the researcher can't have worked or studied in Ireland for more than a year in the last 3 years prior to that deadline. And the EU will fund the postdoctoral fellowship. If you're interested in a postdoctoral researcher, you could also look at the Msca Co-Fund. And a co-fund is where the EU co-finances a doctoral or postdoctoral programme that leverages new or existing funding. So in this case, the applicant becomes a funder. And as Emma was mentioning earlier, that mightn't be feasible for any organisation here today, that they become an applicant in this particular call, but you could think about becoming an implementing partner or associated partner. If you're thinking of as an organisation that you'd like to be part of a consortium, and particularly an international or intersectoral consortium, other types of funding include staff exchange and doctoral networks. So a staff exchange could be useful if you want to broaden the horizon of your research staff and build a research network or consolidate one. So it involves organisations from the academic and non-academic sector coming together to write a proposal with an overarching research objective. And the project is implemented through these staff exchanges or secondments. So there's lots of mobility involved with a staff exchange. And the action funds short-term international and intersectoral secondments of staff involved in research activities. And the secondments are between 1 and 12 months. Or if you're an organisation that has a particular interest in developing excellent doctoral programmes or interest in training a new generation of innovative PhD candidates, you could look at a doctoral network. So a doctoral network as an action, it will provide funding for doctoral training, and the EU will fund up to 15 PhD students over 4 years. So they employ, you can, as an organisation, you can get involved in different ways, including recruiting the researchers or hosting a secondment or participate in training. So the ways you participate in the MSCA will depend on your capacity as an organisation. So there's a number of different ways we've identified here. So you could become an associate partner. So you participate in a network without recruiting a researcher. So you might provide the training, you host a secondment, or you co-supervise a doctoral student. Or you could be more involved as a partner and actually become a beneficiary. So you receive funding to directly recruit or host, supervise and train a research. Or you could become a coordinator or lead beneficiary. So you coordinate the proposal, preparation and the successful implementation of the research. But I thought what I do now is show you some examples, just to give you a flavour of how different organisations became involved and really to plant, I suppose, some seeds of possibility. So in this example here, this postdoctoral fellowship was hosted by Tallaght West Childhood Development Initiative. So a postdoctoral researcher came to CDI to work on a 2-year project looking at the link between early education and poverty. So this was the use of a postdoctoral fellowship. Just include the link of the from Cordis, and Cordis can be very useful in finding out a little bit more details about the project, and it can be useful as well to see what types of projects were funded previously. Here's an example of a doctoral network. This one here was coordinated by Waterford IT. And Orbital was a multidisciplinary global training network, and it was focusing on new treatments for eye disease. So it's coordinated by WIT, but the Charity Fighting Blindness was an associate partner. So no direct funding from the EU, but participation via training and secondments. Here's another example of a staff exchange. The charity, in this case, Huntington's Disease Association of Ireland, was a beneficiary, so it received funding as part of the staff exchange. And the aim of this proposal was to establish an international intersectoral network of organisations, and they were looking at develop a new pathway of patient care and to gain a better understanding of different types of technology that could assist people living with Huntington's disease. So you can see the benefit of a charity being involved. And just a final example I'll give you here. This is an example of a co-fund. This one here was coordinated by Queen's University, and Men's Health Forum Ireland became an associate partner in this co-fund. So again, no direct funding from the EU, but participation based on training and secondments. I thought I'd give you an idea of call deadlines that are coming up, just to give you some sense of what's in store. So a number of calls are opening soon. So we have the postdoctoral fellowship and the doctoral networks on the 12th of May, with deadlines respectively in September and November, and co-funded staff exchange next year. And the work programme, I know Emma mentioned work programmes earlier on, and that details also upcoming dates as well. So I mean, these calls will run in 23 and 24 as well. So even if you feel as an organisation it's not feasible this year, it might be something you think about in following years. I have a slide as well with some resources and some useful links. We start with I won't go through it all, but just to give you an idea, our own website is the first link, so that might give you an overview. We also have the link to the work programme, so just a warning, don't print out these things, they're often lots of pages, but it will give you an idea of what's involved. We have Euro Access, a link to Euro Access hosting offers. If you are interested in hosting a postdoctoral fellow, you can see what other organisations are doing in terms of how they're advertising their fellows to come to their organisation. And with some other links there as well. So that's it for me. Thank you very much for listening. I'm going to hand back now and stop sharing.
Thank you so much, Jane and Yvonne. That was excellent. I think loads of really nice examples there of how charities have actually used and benefited from this program. So hopefully people are seeing opportunities for themselves. And so the idea is the opportunity to get a funded role, I think, is quite even rare for any type of grant funding. So it's definitely something that's worth looking into. So just to note again, if anybody has any questions, we do have a little bit of time. I'm seeing distortion in my audio. Well, look, I'll hand on to our next speaker. We will have time for questions later on, but I will hand over now to Mary Rabbit from the All Ireland Institute of Hospice and Palliative Care to talk about their Horizon project and my support. So over to you, Mary, when you're ready.
So thanks very much, Emma, for that. So I'm from the All Ireland Institute of Hospice and Palliative Care, and our whole focus is to improve the experience of palliative care for people across the island of Ireland. And just 1 second, it doesn't seem to want to move forward the slide. So I'll just try that again, 1 second. And just to give you an overview, I suppose, of our areas that we work in, we're looking to integrate palliative care research, education and practice across the health and social care systems. We want to partner with users, carers and communities to ensure that palliative care meets their needs and continues to do so. And we to support the development of specialist palliative care and also the provision of what they call generalist palliative care, which is, palliative care that isn't in hospices or areas in the hospital, but maybe delivered within the community. We're a collaboration of a large number of partners, includes hospice and palliative care providers, universities, charities. You'll also see the Department of Health in the Republic is one of our partners. So we're delighted to be working across such a diverse group of organisations. So we come together and we have a range of funding from different sources. And I'm going to talk to you today about EU JP&D research that we were involved in or are involved in. So as I said, our role is really as a collaborator on the island of Ireland in the area of palliative care. So to give you some background, the Institute has a palliative care research network, which are leading researchers from our partner base, from both the universities and the hospice and palliative care providers, who would be seen as senior in this area and would focus on palliative care research. They cover 9 academic disciplines, and they're across a large number. I'm going to show you in another slide the groups that are involved. As well as that, we have a Voices for Care group. The Voices for Care group is our group of voluntary people who with life-limiting conditions, family carers and interested citizens on the island of Ireland. And currently we've 36 members in the group and we are recruiting. So I'm just going to put that shout out that if anybody knows anybody who's an experience of palliative care, living with palliative care needs or interested in the area, we are recruiting, and you can find out about us on our website and the recruitment campaign. So they really guide the work of the way we work, everything we do. They sit on our governing bodies and they work within research and our partners in the palliative care sector. So this case study I'm going to talk about is called the My Support Study. It's a really interesting study, and I suppose it's even more relevant now, you know, in COVID-19, but it was developed in 2018, and the aim of it is to support healthcare staff to have those end-of-life care discussions with family carers for people with advanced dementia, because you know, there's a lot of interventions that you might need to think about so that the person with advanced dementia has a good quality of life all right up to the time that they will die. And that was done by implementing, adapting and evaluating an intervention called the Family Carer Decision Support Intervention that was originally developed in Canada. So the study is a 6-country study. It's in the UK, Ireland, Netherlands, Canada, Czech Republic and Italy. And it's led by members of our Palliative Care New Research Network. So it's led by a gentleman called Professor Kevin Brazil from Queen's University of Belfast, who, to give you some background, is a Canadian. And so he was involved with the original development and then moved to Ireland. And so this is how this whole network built up. And it also involves Dr. Nicola Cornelli and Dr. Irene Hartigan in University College Cork, as well as the Institute. We're one of the collaborators on the project. So how did we get involved, which is always interesting. So we knew this call was coming out and we promoted it through our Palliative Care Research Network. So we sent out, you know, this is a call to action. And we then, this was jointly funded by each of the countries that I showed you, organisations, and in the UK by the Alzheimer's Society UK and by the Health Research Board, and it comes up through the Joint Secretariat in the EU. It's organised by them. So we contacted the funders, and especially Alzheimer's Society UK, who are really supporting this, to deliver a webinar on the whole application process. And we did that in the February. And I think in the March timeframe, there was due like a kind of a lighter expression of interest. So our members then, you know, felt very prepared to put in an expression of interest. Then we were invited by Kevin Brazil and Nicola Cornelli to get involved with them in their full application, which went in then in 2018, later that year. And they really wanted us to be involved in the knowledge dissemination perspective, and also the PPI involvement, and the public and patient involvement, and I'll talk a little bit about that. So what do we do on this project? As you can see, there's a nice picture that was taken way back when this project started, which was pre-COVID. And this, I suppose, just to say that the project has handled really well with everything that's been thrown at it over the last while. So we provided, through our project manager, my colleague Marie McKeown, who's an expert in knowledge transfer and exchange. So she really provided mentoring and support for the whole team in the study, and also on the use of our knowledge transfer and exchange model. It's a peer-reviewed model that shows how to plan this for each stage of your research. We facilitated engagement with our Voices for Care group, who I showed you the picture of. And I suppose one of the things they were key to do is, if you see the logo there, the My Support, that came from them. You know, have it as something that's very recognizable and in plain English, and avoid the use of acronyms, which sometimes researchers tend to like. So what we do on the project is we produce the website, we support with the production of blog articles, podcasts, infographics, and there was research videos that were translated into 4 languages as well. And we support the dissemination of the study outputs through our networks. So we're trying to support where we feel we can add value. And I suppose the challenges are to be, if we were thinking of it, is to be flexible, especially with COVID-19. They did get an extension on the project timeline, but they handled it very well. But it also meant that our involvement was extended beyond what we thought it originally was. Working across different countries, you know, there's the different priorities those people have, and also the different time zones. And it's really important to try and understand some of those cultural differences. Specifically for us, I suppose, was around words and phrases that we thought, you know, but they mean very different things in other cultures. So you have to be very careful around those kind of things. And if I was going to say what I'd say to you, you know, if you're looking, is to think that, you know, to budget, you know, build in a good provision, you know, your contingency, because working across countries, you know, it is quite different than just working, you know, within your familiar local or national perspective, and to be aware and respectful of those cultural differences. And another thing, I suppose, is that we really think is to get sign off at each stage and lock content, because you know, with such a large group involved and such, you know, people can want to make changes, and suddenly, you know, so it's important to do that. I suppose for us, it was great to see how this project was implemented internationally. It's very important intervention. It's an intervention within nursing homes for health and social care professionals to support family carers. So it's on a very sensitive topic at a very sensitive time, and it was done during the COVID-19 pandemic. So, you know, that's a great learning in itself. And I suppose it's really increased our contacts and reputation. And I know Emma mentioned that, and Kay mentioned it previously, and Amanda, you know, about that being involved, you know, as a collaborator, as a partner, and trying to build your reputation, and to build the reputation of both in Ireland and on the island of Ireland to get involved. And I suppose, what was the experience like? Well, as I said, it was challenging and rewarding. The one thing I'd say is it's just so good to be able to help our network members to really flourish in this area, because one of our members led on this project. It was the first time leading on such a significant project at an EU level. So we were delighted to, you know, play our part in that. And I suppose the big benefit for us as well is that we can learn from it to look at how we can improve palliative care for future projects. I also just wanted to include there, for anybody who's interested in the area of palliative care, you know, if you have people who may need palliative care needs, from children, young adults, or you want to hear about our research or our free e-learning courses, please go to the palliativehub.com, and it's a real mine of information in all areas related to palliative care. So I'd just like to thank you for that, and these are my contact details. Thank you very much.
Thank you so much for that, Mary. That is absolutely fantastic. And what I thought was really interesting for me anyway is I've managed a bunch of European projects, never in the area of health. So we have the exact same issues of the clumsy things that often emerge.
Emma, it's Avril. Can you hear me?
Yeah.
I'm getting a real problem with your sound, Sarah.
Oh no, it's still happening. Okay, give me a second. I'm going to try headphones.
Perfect.
Yeah, great.
Yeah, much better. So,
Okay, perfect.
somewhat better, not much better.
No, unfortunately, Emma, I don't know. It might be the laptop. I don't know what's going on. Yeah.
I don't know.
I hope I didn't start it, Emma, with my microphone.
It's not any better now. No,
That's it. That's better.
Perfect.
Yeah.
I don't know what I did differently, but anyway, thank you for your patience there. Hopefully, I'm hoping it sticks. So just let me know if it doesn't work. But yeah, Mary, I was just saying, it's very interesting that no matter what the topic of the EU project, it seems the exact same challenges. Like, I've never managed a health project, and yet really clumsy acronyms, translation, cultural and language barriers, and you know, the need for lots of kind of processes and sign off and things like that. Were just really interesting takeaways for me. And just to note as well, like when it comes to the Access Europe can also provide support. We're doing a training soon on the 26th of April around how to go about building a partnership in the best possible way, like involving everybody and kind of building a project in a cohesive way. And we also provide project management supports for the lifetime of the project until people don't need us anymore. So basically, if you're managing a project for the first time, you're not on your own with this. You can always have us to reach out to, and you know, we can hopefully give you some help. So I'm just seeing, I don't know if we have any other questions. If people do want to just pop in anything that they might have, or feel free to unmute themselves at this point as well, because we've only got a few minutes left. If they have any questions for any of our panelists who are still here, we're happy to answer them. But maybe while we're waiting for that, we can just move on and show what the supports are that are available. So I'll share the slides, and Sarah, maybe you can speak from the HRCI perspective about the different supports that are available.
Yeah, Emma, oh yes, I actually have, can I share my ones actually?
Yeah, of course.
Yeah, just do a stop share there, and I'll share mine because I updated them. Sorry, Emma, I just added
No worries.
a little bit. So okay, so sorry, this is just a quick cover slide just to show you the range of members that HRCI has. Just to give you a overview, we have approximately 40 members, and they range from quite large, well-established charities to smaller charities. We have a number of new members this year. So we kind of support the work of Health Research Charities across the board, from the small patient-led charities to the larger ones. And just to give an overview in terms of Health Research Charities Ireland, how we support our members and how we can support our members in engaging in EU funding. So as Emma outlined earlier, PPI and engaged research is increasingly important in EU funding. For our members, we run a PPI shared learning group that brings together members of HRCI who are interested in PPI. We share learning information. We have keynote speakers that give presentations at each of the meetings, and we have a shared folder that contains resources on all aspects of PPI. We've also produced guidance tools and publications. For example, we have a PPI toolkit on how to initiate a PPI relationship. and they have the links there. And we also have a guide to developing a PPI strategy for our charities. We also co-run with the Health Research Board the Joint Funding Scheme. This is a scheme where charities co-fund projects of relevance to them with the HRB. And this can give you valuable experience in research governance and preparing funding applications. A lot of our work is supporting networking amongst our members, and we organize events, workshops, information sessions online, and this year we're back to in person, which is a huge benefit and very exciting. But it gives a really good opportunity for charities to network together, not just with other charities, but also with research offices, funders, and that kind of thing. So it's great. We host talks, we offer workshops and seminars, we provide templates and guides that position you to take full advantage of EU funding opportunities when they arise. And we also offer support on how to develop a research governance infrastructure. And we have produced a research governance guide for member charities. And overall, we are influential in improving the Irish research landscape through the Irish Health Research Forum, which has regular events throughout the year on key topics that are of interest to key players in the Irish health research landscape. And just to finish off, just if anybody's interested, we have HRCI membership and what the criteria are for full membership. You need to be based in the island of Ireland. You need to be registered with the charities regulator. You need to have or seek to have a medical or health or social care research focus, and as evidenced through a research strategy or policy. You need to be patient focused and represent patients' perspectives. For example, you could have this through patient involvement at board or governance level, or for example, an example also would be having a PPI panel such as the AII-HPC described. You need to be available to contribute to the HRCI community and be willing to support the aims and activities of the HRCI and comply with our code of conduct. There's also associate membership, but you can go to our website to find out more about membership and how we can support charities interested in accessing EU funding. So thanks very much.
That's great. Thank you so much, Sarah. And I'm going to just go ahead. I'm not seeing any questions coming in. If there are any questions, we can address them. Obviously, you can follow up by email if you're still kind of mulling over things. But I'll just continue and kind of wrap up what Access Europe can offer. So as I explained at the beginning, we're an EU funding support service. So we provide updates on new EU funding deadlines and programs. So any of you who've had the joy of navigating an EU funding website will know that it can be a challenging and frustrating experience. So we do that for you. Basically, we research all of the calls that are out there for all areas of civil society, and we try to condense them down into kind of easily scannable language that makes it so that you can quickly see, you know, if this is a good opportunity for you or not. And that's in a free monthly newsletter. So we definitely recommend signing up for that, even just to kind of stay up to date about what's out there. I mean, for this particular session, we're focusing on research, but obviously there's all kinds of EU funding streams or under things like education and awareness and campaigns and training and interregional cooperation, all kinds of different ones. So this is just, I suppose, the tip of the iceberg in terms of what could be out there for you EU funding wise as a charity. We also provide free trainings and events like this one. We can do one-to-one advice, application support and signposting. So we can help you make sense of what it is you want to do through EU funding, where the right program, maybe is it an EU for Health program? Is it an MSCA program? You know, we can kind of help to signpost you in the right direction and kind of formulate a strategy for your organization, and with enough notice we can do application support as well, and then networking opportunities locally and at EU level. So that's mainly through our partner database, which we presented earlier and which we will follow up with an email explaining how that works. And hopefully this year we'll actually be able to do like HRCI more in-person networking, so we'll keep you all informed about that. We would certainly love to see in the next few months opportunities to bring together researchers and charity representatives to discuss, you know, shared challenges and opportunities for collaboration through research. So definitely watch this space for that. But yeah, and as I said as well earlier, we do have a training coming up around EU partnership, but certainly, you know, I think one of the big takeaways from today anyway is, you know, there is loads of support out there. There's lots of people that can help you. If any of these things kind of piques your interest, reach out to the relevant contact point, reach out to Access Europe. From an Access Europe side of things, we're especially interested in seeing some successful collaborations between researchers and charities that we can support. So we can give you as much support as possible. If you're thinking about going for an application, we'll be really invested in helping you, because we'd like to see more engaged research, more socially aware research happening in EU funding. So definitely reach out to us and we can help you, not just in the application phase, but throughout the lifetime of the project as well. So just to note that, if there are any, I don't know if there are any other last questions or anything, I'll just have a quick look at the chat. If, Emma, to your knowledge, have many contacts been made so far through the Access Europe Partner Database? Yes, so we know that there's been a few already. It's difficult to manage because it's kind of out there and it's up to people to, or it's difficult to measure, I should say, because it's out there and it's up to people to contact the relevant person through. So we have no way of kind of monitoring how many contacts are being made. But certainly I would recommend that, you know, we design the partner database in such a way that by filling out a form, you are presenting your organization, not just, you know, your contact information, but who you are, what you do, what your strengths are, what you would like to achieve through EU funding. And that's really important. So even if the first thing you're going to do from today is set up one of those databases, it'll help you kind of clarify a strategy in your head of what you want to achieve through EU funding, which is the first step to getting started. And then it can be a communication tool. So obviously we will promote it then around Europe through various networks, and hopefully you'll be invited into projects, but also you can use it to communicate with partners, reach out to researchers, even here in Ireland, who are, you know, who are looking into your topic and say, well, you know, here's a link to our profile, this is who we are, and this is what we do. Maybe we can connect and discuss opportunities for applications together. So even just taking that first step, if you were to take that away from today, I think that would be a huge step forward. The partner database is relatively new. It was only launched in December, but we're doing, so far it's going really well. We have over 50 applications and we're pushing it out into Europe as best we can. And just Kane noted, EU brokerage events are a good opportunity to meet partners, organise when calls are launched. Absolutely, that's something to definitely keep an eye on if you're following a call. You know, keep up to date about what events are being are out there. And they used to hold a lot of those kind of events in Brussels. So hopefully in we're not post-COVID yet, but if we're seeing the end of COVID now, we'll actually see more of those in-person events soon, where you can actually go and meet a bunch of different organizations and start building that European network. And what we found is that, you know, you don't need to make a whole EU network. You usually find one or two good partners, and then they connect you with their partners, and then they connect you with their partners, and before you know it, you have kind of an EU network. So it's not as daunting as it might seem as a beginner. So look, I'll leave it there. I think I can see people are still kind of linking stuff in the chat there, so that's great. We will follow up with the recording, the slides, everybody's contact details, links to the database, all of that. So if there's anything else that you need from us, just reach out and we'll be very happy to help you. That's great. Perfect. I can see some comments coming in, so that's brilliant. Thank you so much, everybody. And we can leave it there.